physician portals. There's a lot of ways to be able to gain more referrals, and one of the biggest things that is happening nowadays are physician portals. A lot of software companies out there that you're using for your data entry for your clients and your patients, or at the same time as you're using for your billing services, are starting to add physician portals. So you want to be able to make sure that your physician portals is something that you can use to get more referrals. A lot of agencies are using this to make it easier for physicians and for referral sources to be able to send you information about patients regarding their discharges and the admission to your home health agencies. So if you already have a current software that you are using and they do not offer any physician portals, there are other standalone portal softwares out there that should be and could be integrated with your particular software. Before you choose any particular softwares, make sure you go ahead and get some recommendations from previous and current customers of theirs right now. Don't just listen to what they have to say or what they say they can offer. Make sure that this is something that can be done. Don't just believe when they say we can customize it. Don't sign any contracts just because they say they can do it. Tell them to show everything first. Prove it that it's going to be able to work. Now, you may have a physician portal, but if your staff, your marketing team, or you as an administrator do not take advantage or do not know how to market the physician portal and how to explain to physicians the ease that it can do for their company, then you're not going to be able to get those referrals. So several tips that I want to give you is that pay attention to providers about their physician access. A lot of physicians are not wanting to jump into this type of software right away. Why? Because they're going to have to deal with multiple referral sources, multiple people they're referring to, and most of the times is their agencies or the agencies they refer to have different types of portal systems. So sometimes they can be a little bit skeptical about using these services. What you need to do is you need to be able to explain to them and market to them the ease that they can happen. And at the same time is, why do you want them to be using other people's physician portal systems when they can actually be just referring all the patients to you? You want to be able to explain to them that you respect their security measures and respect any HIPAA laws and want to make sure that your company makes sure that you have a HIPAA regulation contract between these physicians in order to make sure and to explain to them how it is so important for you to be able to control the information of patients out there.